Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Seizure is basically a disease in which the patient's brain has some electrical abnormal activities, and the patient can present with abnormal jerky movements, loss of consciousness, clenching of teeth, uprolling of eyes, frothing from mouth. These are all the symptoms for the epilepsy, and it's a very common disease of a brain.
What is epilepsy?
Epilepsy is a neurological disorder in which there are abnormal electrical signals which can come from generalized from the brain, or it can come from a part of the brain, and it can affect the individual. Generalized, that is the movements abnormal can occur in any part of the body or to the whole body also.
What are the different types of seizures and do they affect people differently?
Yes, there are many type of seizures. The most common ones are the generalized epilepsy, and the other common form is the focal epilepsy, or what we call as a partial epilepsy. And it can affect, and both of these epilepsy settings can affect any sort of individual at any point of time and at any age.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, there is not always a known cause for epilepsy, but the common causes are some sort of brain tumors, then some infections, fever can cause, then other diseases like demyelination disorders can affect and cause epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
The signs and symptoms, as I already mentioned in previous question also, the signs and symptoms include abnormal jerky movements of the body, which can affect a part or generalized all part of the body, and followed by loss of consciousness, clenching of teeth, frothing from mouth, uprolling of eyes, loss of consciousness, and sometimes the patients may also pass urine and stool uh, unconsciously.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Epilepsy is often misunderstood because people are not aware of it. People think that if the patient is suffering from epilepsy, then it is a disease which can occur with a contact, or it is not a treatable disease. So there is a stigma in the society regarding the disease because people doesn't understand the disease properly.
How does this stigma affect people with epilepsy?
It can affect in many ways. Most common thing is the society doesn't take them for jobs. They feel that these sort of persons are not particularly fit for any kind of job. Then they are often misunderstood by their family also, that they are creating these sort of symptoms deliberately. They are creating these sort of symptoms and they are mimicking, and they are just creating some havoc like of thing. So these are the common stigmas which occurs as in the family as well as in the society at the working place also.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The common triggers include sleep disturbances, like if the patient is not having an adequate sleep, then skipping the meals. The most common one is the skipping the medicines. The patients are on medicines, but they're not taking the medicines willfully, or sometimes they forget just to take the medicines. Then flashing of lights, abnormal sounds, some bright light and abnormal sounds can trigger. Some form of addictions can also cause, like alcohol, smoking. These all are the trigger factors which can cause epilepsy.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Like the trigger factors, he should avoid the trigger factor. The individual should avoid the trigger factors, like he should take proper sleep, take medicines on time as prescribed by the doctor, and take proper food, not to involve in any form of addiction, do exercises and meditation regularly. These sort of things helps a lot.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, injuries during seizures can be prevented by avoiding certain things, like not to go on places where accidents can occur, like avoid fire, avoid sharp instruments, avoid going to height, avoid swimming, and avoid driving. It doesn't mean that you can't do, but you should do all these activities in a supervised manner. That someone should be around, and if some sort of seizures on any episode of that occurs, then someone is there to manage it and help you out, so that major casualty doesn't occur.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
You should follow your and whatever instructions he is giving, whatever medicines and regular checkup, exercises and good personal practice should be done to avoid all these diseases and to prevent from all these diseases.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.